how much time do you think is required generally for rehabbing cuff repairs, impingements, and things like that? And maybe some tips and tricks for people who are watching here because they want the golden nuggets to help them carry on until they see you.
Yep. There is the one answer that I'm going to give that's going to probably not fit anyone's golden nugget. There is no real time that I can give for the reason being that every person that comes to us is different. Every person that every cuff that I see is different, and I don't necessarily look at the time frame. We don't necessarily look at the injury. We look at the person there sitting in front of us. That person may have pain associated with post-surgical intervention and post-surgery, and they will struggle, and we will talk through them about chronic pain. We'll sort of spend longer than necessary. So, rough guidelines, we'll say anywhere between contact sports, anywhere between sort of 6, 9, 1 year sometimes. It's all dependent on number of factors. But I think going back to your question regarding tendon pain in particular, I always say, look, you've got to spend at least 90 days working through a tendon injury. And that's certain, no matter whether you're looking at pain or performance. 90 days is the bare minimum. So that's 3 months. And if you're willing to put physiotherapy or your rehab as part of your lifestyle and just adjust your lifestyle a little bit to factor in time for this rehab, you're going to get dividends. But the problem becomes where people want quick fixes, and I'm sure the boys will, Dan and Rupen will agree that people will come and want things done yesterday. Unfortunately, your body's not Amazon Prime.
My entire approach is that you can't have recipes. You can't have a paint by numbers for any of these shoulder things. They're far too complicated. And everybody has got a head and has got a brain and has got emotions and is a big soup of psychology and all the other things that we have to look for. And you can do the same operation and send the 2 people to Rush, and he will spend 9 months on one, seeing them once a week every day, and the other guy he'll give a piece of paper to and he'll say, you're off, mate, you're fine. And both of those are right, but for that person, for that individual. And the same around who we offer surgery to, that's the other thing. We're all dealing in quality of life medicine here. It's not cancer. So you've got to remember that there are options and you don't have to do anything. But the best way is often to know your patient